Hi everyone, this is Katie Myers. I am a nursing student at Indiana State University. I am in Nursing 444 with Dr. Lucky, and for this presentation, I am doing type 2 diabetes in pregnancy. So basically, it's just type 2 diabetes mellitus during pregnancy, not those two separate. Objectives for this presentation. Participants will understand what complications come with pregnancy when the mother has type 2 diabetes mellitus. Number 2, viewers will be able to recite interventions to assist with complications from type 2 diabetes mellitus during pregnancy. Number 3, listeners will be able to understand the A1C ranges that are ideal for expecting mothers with type 2 diabetes mellitus. And lastly, participants will understand prevention methods for complications due to type 2 diabetes mellitus during pregnancy. Pretest. If you look in the description box below, there is a link. That link will lead you to a document that has a handout which goes over everything discussed in this presentation. It also has a pre-test and post-test with the answers on the next page. Please go ahead and take the pre-test now, and when the presentation is over, take the post-test to see how you've done. So please again, pause the video and take the pre-test. Okay, moving on. What is it? So first we're going to say what is type 2 diabetes mellitus. It is when the body does not produce enough or does not accept insulin. Now, insulin is produced in the pancreas. So this is just not accepting that insulin or not making enough of it. It is a chronic condition. It is not acute, and it usually is lifelong. You can control it different ways, but it is usually always there. I have not met anyone or heard anyone who has totally been cured of diabetes. Symptoms of diabetes. Increased thirst, increased urination, increased hunger, and it can lead to blurry vision due to glucose, different levels of glucose. Now for this presentation, we are talking about diabetes type 2 with all the symptoms I just mentioned during pregnancy. It's not about diabetes mellitus type 2 in general. It's very specific. Prevention. How can you prevent complications during pregnancy? This is not prevention of diabetes itself. Preparation and conceiving. Make sure you talk to your provider or providers and let them know that you are trying to conceive a child. They will let you know what steps can be taken to decrease the likelihood of risk factors and complications. Fasting glucose screenings. Make sure you get your glucose checked rather often, as you want to make sure your glucose is controlled before conceiving a child. This will make it easier on the mother and the baby. Treat underlying complications. If the diabetes is causing other complications such as neuropathy or glaucoma or causing hypertension along with that, or separately, make sure you treat those as they can lead to further complications. Review of medications. You should be doing this at every visit you go to with your provider. However, it is extremely important now to go over them if you are thinking about having a child. That is because insulin is the #1 choice for diabetic medications when pregnant. And that's because metformin does cross the placenta and can cause prematurity for the baby. Also, metformin and other oral medications have not been studied enough compared to insulin when you're pregnant. So make sure to talk to your provider about that. Interventions. Like I just said, insulin is the choice of medication when doing diabetic control during pregnancy, not metformin, not Januvia, anything like that. Changes in lifestyle. Make sure you have your nutrition under control. Make sure you have exercise and weight management. When I was doing the research, I found out that if you are considered overweight, it is only ideal for you to gain 15 to 25 pounds during pregnancy. And if you are considered obese, you should only gain 10 to 20 pounds. So make sure you do that. Follow up with the provider. This is important because the provider is going to monitor the mom and baby. You want to make sure that you're living a healthy lifestyle. That way, the baby's getting everything it needs. Your glucose levels are under control. That way, you decrease the likelihood of complications. And then medications. We want to make sure you're taking medications safe for the baby. And if you have those complications, or morning sickness or any other complications, the provider will be able to assist you in picking out medications that are safe for both the mama and the baby. Statistics. All non-Caucasian women who have type 2 diabetes are at greater risk for having complications from their diabetes. Spontaneous abortions increase, I believe it said it doubled with uncontrolled diabetes. Congenital malformations, increased risk. That comes with type 2 diabetes. It also comes with type 1 diabetes. Metformin can increase premature births. This is what I saw because it can cross the placenta, and it's not really studied, but 2 of the readings did have this in here, and I thought it was interesting, so I put that in there as well. These are the references I used. I do want to mention, because I did not put on the slide, the A1C level that is recommended during pregnancy is 6 to 6.5%. They feel that they, like as in providers and the researchers, feel that that is the appropriate level to help control the diabetes, but also aid in the growth of the baby. But these are the references I've used. There are also many other references that you can use. I know the CDC has a really good site. There is the American Diabetic Association that had a lot of similar information, like these 4 that I have listed here. And then if you see, I have 2 of the Management of Diabetes in Pregnancy journals. They have more journal articles about diabetes and pregnancy, and they go more in depth with different diseases and processes. And I think they would be very helpful in, looking over and seeing what information you need. Also, you can go to the Mayo Clinic website. They had a lot of useful information. But please leave any comments, questions, or concerns down below, and I will try my best to answer them. Thank you.